Welcome everyone, and thank you for joining us this evening. Before we get started, just want to let everyone know that this webinar does offer closed captioning. To enable closed captioning, click on the live transcript button on the bottom of your screen and choose your preferred method. And welcome to the MPV Monkeypox Your Questions Answered webinar. We do encourage attendees to ask questions. Please use the chat box to send your questions. There will be a Q&A at the end of the session, at the end of the presentation, and we welcome questions during as well. I now turn it over to Mark Leverson, who will be moderating this evening's webinar. Welcome, Mark. Oh, you are muted.
Thank you so much. We're happy to be here and appreciate people joining us for this conversation, as well as the panelists, who I'd appreciate if they could introduce themselves. Why don't we start with the Howard Brown team? We have Dr. Patrick Gibbons.
Hi, everybody. Dr. Patrick Gibbons. I'm the Chief Medical Director at Howard Brown. I'm also a physician out of the Halsted Street location. My pronouns are he, his, and him.
And we have David Munar with us.
Good afternoon. My name's David Ernesto Munar, President and CEO at Howard Brown Health. I use he, him pronouns.
Thanks, David. Then from the Health Department, we're joined by Patrick Stonehouse.
Good evening, everyone. Patrick Stonehouse, Director of Public Health Operations for the Community Health Services Division of Syndemic Infectious Disease Bureau at Chicago Department of Public Health. Syndemic infectious disease, for those who, it's fancy speak for HIV, STI, viral hepatitis, and tuberculosis. And thank you. I use he, him, his, but anything with respect is fine.
Thank you very much. Antonio King.
How do I follow Patrick Stonehouse's intro? My name is Antonio King, Public Health Administrator and LGBTQ Health and Outreach Liaison with the Chicago Department of Public Health. He, him, his, or Mr. King. And thank you for having me.
That is how you follow Patrick Stonehouse. Exactly like that.
Well done, well done. And Jana Cairns.
And I get to follow everyone. Hey, thanks for having me. My name's Jana Cairns. I'm a medical director and an epidemiologist at the health department, and working on MPV full time now.
Thank you again, everyone. We want to let people know also that we're going to be attempting to monitor the chat, also in the Q&A. If you want to send questions to us, I'll be watching that throughout this conversation. And our goal here is to try to educate people, share information about MPV, the ongoing and new classification from the state, which hopefully will provide additional resources to our communities. I think the best place to start really, oh, by the way, I should introduce myself as well. Mark Leverson, he, him pronouns, and I am with the Northalsted Business Alliance. I'm the chair of Market Days and also the owner of Hydrate, Replay, and Elixir. And glad to be participating in today's event. Jana, I think a great place to start is just catching people up on where we're at with this virus in our community. So I'll turn it over to you, as I know that you've got the numbers and you've got the information on this.
Sure, and apologies to share slides because I know they get overused a bit, but for this case, I am gonna share some, so hopefully you can see those. And then I'm just going to go through some of the data and some of the basics on this, and then I'll turn it over to others. So this is where we're at globally right now for MPV. There are now over 23,000 cases that have been diagnosed in 80 countries. And so the difference here in between the blue and the orange on the map is just that 73 out of these 80 countries in orange are places where we don't normally find MPV. And then looking a little closer to home, in the United States, we're almost up to 6,000 cases now. This was as of yesterday, in actually 48 states. And then for Chicago, so a couple things. One is we now do have our data available on the website. So that's listed at the bottom, Chicago.gov/monkeypox or Chicago.gov/MPV. And this gets updated every weekday, so people can see this and follow along for themselves if they'd like. But what we're seeing right now is we're up to 445 total MPV cases in Chicago. Of those, 20 people have been hospitalized due to their MPV symptoms. And luckily, no deaths have occurred here. And largely, there have not been many deaths that have occurred globally either, but we are aware of now, I believe, 4 or 5 deaths that have occurred in Europe, South America, and Asia, places where we don't normally see monkeypox again. And then on the bottom is just a graph of the cases over time, so by week. And this is just showing that last week is this week, so it's in gray, the week hasn't ended yet. And this is just showing how the cases have increased here over time. And then just a little bit about the people who have MPV. So on the left is just what the age categories we're seeing. And the vast majority of people have been between the ages of 25 and 44. No kids or anyone under the age of 18 has yet to be diagnosed here. And the vast majority of individuals identify as men. And then there are some of these just what's listed as unknown, and that is likely just people who we have not been able to interview yet. And then in terms of race ethnicity, what we've seen is that really all parts of the city are affected. So about 45% of the cases so far have identified as white, 30% as Latinx, and then 14% as Black non-Latinx. And then in terms of sexual orientation, for those where we know sexual orientation, the vast majority have identified as gay. And just a couple of basics on MPV, hoping that I won't repeat things that others will be saying, but just to go over a little bit about how MPV is spread. It is primarily spread through close contact, and what we've seen is largely close, intimate contact, and including sex, but also other types of contact can be a risk too, including kissing, cuddling, or other skin-to-skin contact. It's really direct contact with somebody's rash themselves. That's what spreads MPV. And the primary symptom is a rash or sores, but flu-like symptoms can occur. And then in terms of who's at risk, we know that anyone can get MPV. Viruses don't discriminate by gender, race, sexual orientation, any of those things. But as I just showed, in Chicago, we have seen that the vast majority of the cases have been among gay men. And then just at the bottom is a little bit about what you can do if you or your sex partners feel sick or have a rash or sores or concerned you might have MPV. And basically, kind of the main thing is to avoid that close physical contact. Don't share things like bedding, towels, linens, also fetish gear, sex toys. Wash your hands frequently. And then, of course, contact a healthcare provider. And these are just some ways you can prevent MPV. So just really quickly, talk to your partner about if you're feeling sick, if you have sores. If somebody that you are, about to be intimate with does have a sore, don't touch that, and then encourage them, or if you are the one that has a sore, to see a healthcare provider. And then, like I was just saying, try not to share things like towels, bedding, linen, also dishes and utensils as well. And this is some of just what I just said, but in terms of what you do, just isolate, call your doctor, get tested. And then if you've actually been diagnosed, making sure that you stay home, ideally until your rash was actually healed. But if you can't stay home that entire time, then at least while you're having those flu-like symptoms, fever, fatigue, cover those sores when you're around other people, wear a well-fitting mask, and then don't share kind of the same things that we've been discussing before. Avoid close contact with others, avoid crowds, and wash your hands regularly. And I think at that, I'll turn it back over to you, Mark.
Thanks, Jana. I appreciate the update. And I think that we can keep moving along and turn it over to the Dr. Gibbons and perhaps other members to begin talking about what we're seeing, hearing clinically, what is going on medically in terms of the people who are getting infected, what common denominators are you seeing, and basically just educate us the best you can.
Yeah, of course. So, at Howard Brown, serving, Chicago's LGBTQ community, and being positioned to do so during this, health crisis that we are currently experiencing, we are seeing the lion's share of cases coming in for monkeypox screening. We're seeing a lot of people coming in, being affected, and very much so properly identifying themselves as likely monkeypox cases. So what we have seen is a tremendous amount of awareness already in community, and folks coming in saying, hey, I think I have monkeypox. And then, the vast majority of those folks that think they do have monkeypox, are indeed correct. So when we're testing within the clinic, our positivity rate is pretty high for the folks that are coming in. We're seeing a lot of people coming in, with kind of a range of symptoms. Some people come in and have a few pox lesions that are isolated to, one part of their body, and are not experiencing much discomfort and don't feel very unwell, and are, having a course that is more mild. And then we're seeing other patients that are coming in and having a more severe course that requires supportive care, along with pain control, symptom control, and for a certain amount of people who fit into a criteria outlaid by the CDC, we're even handing out medical treatment with a medication called TPOXX, which is an antiviral medication that can be used in severe cases where we're really, at a point where we're thinking somebody might need to be hospitalized or will need to be hospitalized if we can't kind of turn the course of their infection. We are also offering vaccines out of Howard Brown, out of all of our locations, and we are offering vaccines in the community, in the neighborhoods that we serve and beyond through outreach events. We are looking forward to getting much more vaccine as it becomes available and trying our best to meet the need of community.
Thank you, Dr. Gibbons. I appreciate that. Do other members of the panel have anything to add to what has been shared?
Well, I wanted to jump in before we get too far into some of the data that has been shared by Dr. Cairns. Because I noticed in the chat they're asking about vaccination events. And what I wanted to say, what I bring to this particular webinar, I know, is that we are doing our best to ramp up our efforts for vaccinations within the Latin and Black communities right now, because what we don't want to do is to have the 45% Latin to explode, or the 14% African American that is now infected to explode. So we are offering more events and supporting other events on the South and West sides at various locations. You can go to our website, Chicago.gov, and there should be a list of places other than Howard Brown is great. Other than Howard Brown, there are some other locations and other facilities, some traditionally clinical, some not so traditionally clinical, such as Task Force on the West Side, where you can get vaccinated. Because what we want to do is we want to make sure that we contain and control it. I saw in the chat that someone was saying that, we didn't do a great job of controlling it. Well, we're trying not to be reactive. We want to be as proactive as possible. And with the efforts that Howard Brown and all of their locations are doing, you can't get to everyone, but they've got so many locations and facilities that are being accommodating to, we're doing our best to make sure that anyone who wants vaccination, while we have the vaccines available and more vaccine is coming, and I'm sure someone else will speak to that, but we want to make sure that we get those vaccines into the arms of our citizens, not just those individuals. Well, I'm not going to say that. We want to get them into the arms of the priority populations, of course, first and foremost. And there's an eligibility, there is a requirement that we want to make sure that you follow, so that we make sure that the populations that is impacted the most get the vaccination, so that we can stop it while we can.
And thanks so much, Antonio. And we are going to address the questions that are being submitted, and we'll get to them. We've reserved a significant part of the time that we allocated for this meeting today to answer questions. And no, you're fine. And we're eager to do that. So I'm hoping that we'll get some of those questions actually answered as we go through this initial part of this town hall, and that will help people and hopefully answer, like I said, some of the questions people have.
Can I go ahead and add something, Mark?
Yeah, of
Thanks.
course, Patrick, I'd appreciate it.
So I just want to, it's a struggle, right? With a limited supply of vaccine and a lot of word going around and people being concerned and people having experiences and fears and like scares with MPV specifically, like knowing people who have it, but not having been in contact with them. It's a delicate balance that we as the health department and as like providers and community members have to strike of access to getting vaccinated. So wanting to make sure it's as accessible as it can be to the individuals who will benefit from it most, meaning the individuals who are at the greatest risk of acquiring MPV based on behavior, circumstances, social and sexual networks. At this point, we can't just open it up for the world, much as we would like to, but we can't responsibly with a limited supply of vaccine. Once we get to the point where like hundreds of thousands of vaccination doses available, like let's go nuts. But in the meantime, there needs to be some kind of screening criteria in place so that it is getting to those individuals who are at the greatest level of concern for acquiring MPV.
And can I just add to that we know that vaccine is in limited supply right now. And I totally hear people on how frustrating this process must be. We simply don't have enough vaccine right now to vaccinate everybody that is eligible. But more vaccine is coming. It's coming maybe not as fast as we'd like. And so we will be opening up additional sites and locations for vaccination. And I think we do hear the call to try to make those sites and locations more publicly available as well.
Yeah, I wanted to address some of the concerns about gaining access to vaccines. It's been very difficult to keep up with demand. We have both the dual challenge of limited supply and then limited people to schedule, and as well as limited slots. Over the weekend, we received over 5,000 voicemails requesting appointments. We're working through those, and we've actually added some additional staff to help us figure that out. We realize that means a lot of people are waiting for a callback, and we apologize for that. It's just the crush of this moment. I put in the chat and do recommend that people call and wait to speak to someone, which is easier than giving us another voicemail. We are scheduling out, and we are hoping by the end of this week or early next week to pilot a online scheduling tool to make it easier for individuals to submit their information. So we want to get to as many people as we can at our sites, and unfortunately there's more demand and too little vaccine and too little vaccine appointments, but we're working really hard to try to meet that demand. We realize that this has been very challenging. I know Mark has been very concerned about this as well and calls it the Hunger Games of getting a vaccine, and it has truly been difficult for people who need access. I mean, we have kind of a crush of people that are coming forward, and we're grateful that they're taking action to protect themselves and their partners and those around them. And then we know that there's folks that need a vaccine and will benefit, and for a variety of reasons may not come forward, and so we want to reach them as well. So there's a lot of dynamics we're trying to respond to.
You know, it's a good problem to have that the public, we've conditioned the public now from COVID to get vaccinated. So now that something's come up, everybody's in tune with wanting to get vaccinated, and it's a good problem to have. But then it's like we don't have the resources. So I'm really impressed, because I remember the days during COVID when we were trying our best to get people to get acclimated to the thought process of getting vaccinated, conducting vaccination clinics all over the city. And now we've got people wanting to stand in line to get those vaccinations. So I think that's a great idea. It's a testament to what the work that the providers and the public health departments across the country have already done with acclimating our citizens to vaccinations and the need and the accommodation for them.
And I appreciate, David, that Howard Brown is listening to the concerns people have about the long lines and the challenge. I think that it is adding a stress to the situation. Obviously, that message has been heard, and they're working to remedy that. I do think it's important to share with people what was shared with me, that the reason there's a limited amount of the vaccine. The health professionals identified a pattern where they were seeing the infection emerging, and they discovered that while it's not a sexually transmitted infection, that it was primarily being transmitted from people who were having multiple sex partners, and this led to an effort to cut off the expansion of the spread by trying to target within those groups and surrounding groups. And if I'm doing a poor job of explaining this, please jump over me at any point. But that initial effort was a really critical effort, because right now we're at 445 cases in our city. We're a very large city, and so as a percentage of our population, it's still not that widespread. And there's an opportunity, by understanding what it is that are the initial symptoms for this virus, to be self-aware and keep you from spreading the virus to others, that we can begin to have people removing themselves, as Jana suggested, or at minimum covering up anything that could possibly be a source of infection, like a rash or pimples. And then the secondary element is being aware of the most at-risk activities that are leading to the spread. I think in combination, we have an opportunity to hopefully keep numbers low as we move forward toward getting the vaccines that we need. But if anybody can speak to any of that, or if we want to talk about, and I think it's really important that people get this, because the news did a really terrible job at the beginning. People saw these grotesque images of pox and whatnot, and that is not what people are experiencing initially with monkeypox. And you need to be self-aware of what it is that the initial symptoms are. And you talked to me about this, Patrick, where you get people coming into your office and how it is that you're finding the pox and whatnot that they're not even aware of there.
So we're speaking to, the presentation that we're seeing. Most folks are getting a prodrome, a viral prodrome that feels a lot like the flu. So they're getting a fever, they're getting body aches, they're getting a sore throat, they're getting lymphadenopathy, where their lymph nodes are swelling, and they're most often in the groin area, but it can be up around the neck as well. And that lasts for a series of days. They feel really tired and wiped out, and they know something's going on. And then the actual pox lesions pop up after that. For a lot of people, they are showing up kind of in the underwear zone, so around the genitalia, and then also around the anus area for folks. We are seeing a pattern that is a little bit different from previous monkeypox outbreaks and how we know historically monkeypox has behaved. You know, rather than having all the lesions kind of show up at once, the lesions are taking a more kind of prolonged course, so they show up over a series of days and can form you know, new lesions over the whole course of a week. The other lesions that pop up, you know, besides in the underwear zone, do have, you know, are more often seen on the arms and in the face. It's very common, and we do see it in the mouth as well, for the areas of the body that it's seen.
I want to like take a moment to address something that I've seen popping up in the chat and has been like an ongoing conversation. The idea of or the question of like relative risk comparatively across different settings and setups and activities and behaviors. So the question that I see in the chat, like what risk do I have of brushing shoulders with someone, is similar to questions that have been put up of like, you know, at the grocery store or at the gym or even like going out dancing. And I put it to the rest of this group to speak to it, but casual contact is not the transmission. It is intimate, generally, as we've tracked it back, sexual contact. And, you know, understanding that there's a range of what different folks might define as casual. Like, I ride the train every day to and from work. I'm not really worried about sitting next to somebody on the train, whether or not that individual has monkeypox. Now, if I see that person is having like warts or lesions and such on their shoulders and they're not wearing a shirt and I'm wearing a cutoff, which I don't do, but if I were, then I might like make sure I got some room. But otherwise, like the general course of daily life, this is not where we're seeing transmission take place. It is about, generally speaking, sexual contact with an individual who has the sores and rash, correct?
Yeah, and just to add to that, MPV is not as easily spread as, say, COVID. You know, we've been trained over the past 2 years to think about, you know, being within 6 feet of someone, making sure to wear a mask. And MPV is a different virus altogether. The main way that it's spread is really through the direct contact with the sores itself. And so that's really where that close, intimate contact comes in. There is a lesser chance of spread, which can happen through what we call respiratory secretions. So think coughing, sneezing, but rather than that kind of 15 minutes or even kind of airborne that you think of with COVID, this is something that really takes prolonged periods of time. So think more like 3 hours of being in the same room with somebody who's coughing before we would suspect you'd get it. So just to add that on to what Patrick was saying, it really is something that's much different. And in terms of casual contact, you know, it does depend on a lot of different factors. So, you know, how long are you in contact with someone? How much clothes are you wearing? Those things make a difference too. So I completely agree. You know, this is not something that we think would easily spread, you know, just at a grocery store, just walking by somebody, bumping into somebody, even just giving like a quick hug to somebody to say hi. It's unlikely unless somebody had a lesion like right there, you had a cut and you managed to somehow get some of that fluid into an open cut.
I think it's important for people to understand, while this is not an STI, because obviously the history of monkeypox is being spread amongst family members in Africa, is that right now, as Patrick pointed out, in the population he's seeing, there's significant amount of activity that's either involving the, you know, as he put it, below the underwear. And so he also had mentioned to me previously about the impact of bodily fluids and saliva, and just mucus in general in terms of transmission, and that does require more close contact. I don't know if you want to add anything to that, Patrick. Otherwise, I'm going to start hitting these questions because it seems like that's where everybody really wants to go anyway, unless there's something else that someone wants to bring from the original plans for our agenda.
The only thing I want to add, I guess, is like, oh, sorry, go ahead, Dr. Gibbons.
Oh, no, go ahead, Patrick.
One thing I want to add is like, it's a messed up time for something like this to come along, right? I mean, we've been isolated and quarantining and freaking out over public health for the last couple of years, and for some individuals for the last few decades, thinking about HIV and sexually transmitted infections. But like the increased pressure that individuals are feeling as humans because of COVID, the level of frustration and tension and I'll say like sadness and trauma involved in like COVID seemingly like coming under a certain amount of control. We got treatments, we got vaccine, everything's great. Summer's coming, we got all this cool stuff we get to do, and monkeypox. Like, it's understandable. And I think we have to be able to appreciate the fear and anger and frustration that something like this comes along. It isn't a fault. Everybody is working as hard as they can for something that we did not expect to come our way. It's not like anyway, I just think it's important for us all to acknowledge the stress that this is putting on like individuals, communities, populations, and our overall society. It's a mess, but we got to deal with it, because not dealing with it doesn't help. And that gets dealt with by sharing information and getting it to the folks who need it most, who will benefit from it the most, and working with each other to make sure that that works.
Thanks very much, Patrick. And I think that, again, that's part of why it is that we are stressing what we're stressing, so that people understand how it's being currently transmitted. 95+% of the cases, how it's being transmitted is linked back to people's engagement in more intimate contact. And then the secondary factor is getting people to be aware they're not looking for giant, grotesque pox on their bodies. The symptoms are not the stuff of movies. It's the symptoms that are, as Patrick had referred to, Dr. Gibbons referred to, the viral symptoms. It could be mild fever, or it could just be that you see some new development of rash or potentially pimples on your arms or in your groin or potentially face, which are the primary regions that they're seeing initial outbreaks occurring. Being self-aware is how we're going to help to tamp this down. There's tons of questions about vaccine. The vaccine issue has been addressed, I think, pretty thoroughly. There's an effort from Howard Brown. I'm hoping that Rush and UIC will join it to create some kind of method of online appointments, so that this kind of Hunger Games of medicine will go away, because it's just, I know that it creates a lot of stress. I feel real bad that that's occurring, and I wish there was something that I could do about it. But and I know that the healthcare providers want to do something about it also. So I'm glad that David and Patrick are working on this, and I'm hoping that will encourage everyone too. But the biggest issue with the vaccine is the supply. It was a small company that's out of Denmark, I believe. In the meantime, there's shipments and there's production going on, but they're not here yet. So what do we do in the meantime? Let's try to address that so we can continue to live our lives as Patrick suggests. What do you advise on second doses? I received my first dose more than 28 days ago, so I'm eligible, but I understand that first doses must be prioritized. So what is the difference? First dose, second dose? Tell us about that. And should people wait?
Sure. So I can start on that. Others are welcome to join in. So the main dose that's being offered right now is called Jynneos or Jynneos vaccine. It's a vaccine that's been approved for monkeypox and also for smallpox. And it's a vaccine that we use both kind of for people who have been close contacts, also for this expanded post-exposure prophylaxis, we call it, but for these larger vaccine clinics. So it's largely just this one dose that's being used. Traditionally, this is a 2-dose vaccine, but currently right now, what we're using the vaccine for is to control this outbreak of MPV that's happening. And for that reason, and because we just don't have enough supply, we are prioritizing these first doses. And when the supply improves, then we will be getting second doses out to people. What we've seen based on the data behind the vaccine is that the biggest increase in protection is the one that occurs after that first dose. The vaccine does not take effect immediately. It takes about a couple of weeks for that first increase in immune protection to occur. And then even if you delay kind of that second dose, it doesn't affect the long-term immunity that occurs. So we've been using this approach, as have many other locations, both kind of within the United States and outside of it.
Thank you. So there's comments made about, and here's what I'm doing. I'm hitting the Q&A first, and then I'm going to go into the chat. There's comments made about the CPDH failing to control this, and the communication. And I hope that people are hearing what's being said. The lines lit up at Howard Brown, at the center, you know, the really everywhere, the Department of Health, and it's just a matter of being able to get questions answered, which is why so much information is being put out on websites and why we're doing this kind of a webinar. So I do understand that it's nice if everyone could reach someone. Does anybody have anything else they want to add to that?
Well, I wanted to add, because I saw a comment in the chat, that each provider that has their surplus of vaccine is setting up their own registration process. There's not a process at the CDPH website has the registration process for our clinics. So the information concerning where to get vaccinations or the sites are not just CDPH sites. We have other sites on there, but each of those, aside from CDPH sites, the other providers have their own registration process that they're going through, then their own callback process. Although it's busy, yes, I do know several individuals that are not located on the north side who got their callbacks from Howard Brown. So the process is working. It's just that, as you stated, the staffing, the amount of vaccines. So I just want to address that about registration. We don't know everyone's registration process at CDPH, and other providers don't always know another provider's registration process. I just want to throw that in there.
Thank you. So someone asked specifically, how much protection does one shot give? And then also, I guess I can tag onto that. If it's a 2-week period for the protection to work, what are people getting from it who are getting vaccinated at this point in advance of market days, and also at shots that may be given out during market days?
So the way that we look at protection, or the way that studies have been done that look at protection from the vaccine, is to basically look at the antibody response. And so I don't have kind of the numbers. There are papers available, which I can get data. I'm happy to follow up with someone about like the actual data. But we do see kind of that biggest bump in the immune response, so which we get from serology after the first dose, and then a continued bump after the second dose. And the way that the doses are supposed to be given is they're supposed to be given at least 28 days apart, so they can be given farther apart than 28 days.
Okay, another question. Can anyone discuss what the general timeline of it? Oh, and the other thing with regards to the vaccines, it was mentioned to me that people who are getting vaccines at this point, if they do get exposure, there's a certain amount of prophylactic impact, that there's a benefit there. Is that accurate? And how does that work? Patrick, your mic.
And I'm sorry, you broke up there a little bit, Mark. I'm not sure if I'm having the only trouble.
Oh,
if I'm the only one
sorry.
hearing you, but
I was basically asking about the impact of a vaccine prior to that 2-week period.
So basically, like if I get vaccinated today, what level of protection will I have?
Yeah, and what's the
Saturday?
impact of the vaccine? I've heard the word prophylactic used in terms of the vaccine's impact if somebody should be exposed. You want to hit on that at all?
Yeah, if given within 4 days of an exposure, you know, it has the potential to help you avoid actually developing monkeypox. If given between 4 and 14 days after an exposure, the belief is that even though it might not prevent an actual episode of monkeypox for you, that it would decrease the severity. So that's part of the population that we're targeting with vaccinations at this point is as a kind of post-exposure prophylaxis. So when there's contact tracing being done after we have tested somebody and we have come to know that they're positive for monkeypox, then we talk to them about their partners, anybody they can identify that they've had close intimate contact with, and we try to get those people in for vaccination as fast as possible. In an effort to provide that monkeypox PEP by way of vaccination, and the sooner the better.
A good comparison, thank you. Someone's asking a general timeline regarding the infection from exposure to the first symptoms to first lesions, etc.
The incubation period is anywhere between I think it's 5 to 21 days. So usually people are showing symptoms within about a week or a little bit less than a week. You first get that prodrome of a viral prodrome where you feel, again, I think I mentioned earlier, you feel kind of like flu-like symptoms, feeling achy, feeling pretty unwell, tired, fatigued, sore throat, maybe even sniffles, lymph nodes popping up, cough in some cases, and sore throat as well. And then about after, a few days to even up to 5 days after that, you'll start to see the lesions appearing or the pox appearing. And they go through their own stage as well. And then, at that time, you're really looking for anywhere from another, probably another couple weeks of that course. On the low end, we're seeing people become symptomatic, go through the pox evolution of those lesions, having them dry up, scab, and fall off on the low end at about 2 weeks. And then, we don't have a lot of people making it to 2.5 or 3 weeks. The data says it can go up to about 4 weeks, but I think that's in very severe cases. And that's, from anecdotally what we're seeing, we have not seen anybody extend up to 4 weeks to kind of cycle through the whole course of infection.
And I just wanted to add that we're also seeing a real variability about those initial symptoms. So in some cases, that initial symptom can be severe, kind of body aches, headaches, fever, or they can be very mild symptoms that mimic more like asthma or a cold. And so, and then the rash can be in a place that you can see, like the trunk of your body, your face, your arms, your genital area, or somewhere that you can't see easily, like in your mouth, in your throat, in your anus, urethra. So there are people that may not notice that they're because the symptoms are so light, or won't notice until they become very severe. And in that period, it is believed that transmission can occur. And so, without somebody knowing, it could be the beginning of their infection. And that could be a period when they could expose others unknowingly.
And I think it's really important, again, that we keep thinking about what it is that we've been telling people in terms of how you can avoid this infection, because if you're, for example, as Patrick was discussing, on a train with somebody, or even if you're on a dance floor with someone, if they have rash or some type of pimples in their body, that's something where you really need to be conscious of. But we need people to also be self-aware, because the only way that we can stop this from turning into a wider spread is by people being aware of themselves and what it is that's going on in their body, and also thinking about their behaviors, because it's been clearly linked to intimate contact, and that has been the #1 method of transmission. Over 95% of cases are related to that, so that's a tell. The next question is regarding, and actually, if you don't mind, I'm going to hit this first because it's regarding market days and whether or not it's responsible to move forward with market days. If it's can it be a super spreader event? So we've discussed a lot with the experts, and that's part of why we're doing the communication method that we're doing. We're really trying to get people educated about the virus, its initial symptoms, and also to be aware of how the virus is spread. The good thing also is that, if you had a t-shirt on, the clothing provides effective protection against transmission. There's many different ways that you can choose to avoid getting the virus. Making out with someone on a dance floor is probably a lot more risky than dancing with a group of friends. Being, unaware of who it is that you're with sexually would probably be considered more risky than an ongoing partner, and having good communication, just as we did with many other infections, to be able to ask difficult questions or to not put yourself in a situation where you need to ask those questions. And those are all difficult things, and we all recognize that. But right now, without the adequate vaccine supply, this is a very small outbreak, and the goal is to keep it from growing into a large outbreak. And so that's what we're hoping to do with this education. That's what we're hoping to do at the entries. We appreciate that the Chicago Department of Public Health will be on site at the entries educating. We'll have posters, videos, everything else communicating the same type of messaging, and hopefully that will help to impact the likelihood of anybody having this spreading. If it was an orgy scene going on the dance floor or in the streets of Halstead, then it would be probably a higher risk. But even with these numbers, it's a small percentage of the 100,000 plus people that are going to be there. Who wants to add on to that, please? Anyone?
Sorry, Mark, I keep on missing the tail end of what you say. What was that?
Well, I'll just let you pick up from where you want to, Patrick, rather than repeating it all. Basically, I was just communicating that if there is a awareness and a change of behavior, that you can make a difference on whether you're likely to be exposed to this virus or not. Being self-aware is also going to make a difference on whether you're going to be potentially infecting someone else or not. And in combination, we could have a tremendous impact on keeping this from growing beyond the less than 500 cases that are currently in the city, and having it become a larger, wider, and more dangerous situation, which is what the goal is.
I think one thing I'd really quickly like to add is that sharing of information from the health department, from organizations like Howard Brown, but not just limited, like looking at like Alliance Care 360, looking at Southside Help Center, looking at Center on Halstead, looking at all these different organizations that are involved in pushing out information and helpful information, but also as actually mentioned in the chat, somewhat in a disparaging manner towards us, like amongst ourselves, and sharing like trusted information, accurate information between one another. Like I'm actually like, I love seeing things coming in the chat. Like I've created this resource, like beautiful. There is absolutely no way I would have known that. Share it with your friends, share it with your social networks. If it's accurate information, I love it. Get it out there. Like our ability to communicate to people whom we care about or whom we know, or like there's nothing like that. And there's a certain amount of like, the health department says this that gets to some folks, and there's a certain amount of I don't listen to anything that the health department says, no matter what it is, no matter who it is from the health department who says it. There needs to be information exchange from a number of different sources. It needs to be accurate. It needs to be done in love, and that's where like group meetings like this come in, of sharing the information as much as we can, because that is one of the most significant preventative things that we can do, is make sure folks know accurate information. So when we go into different settings, we're making a calculated, conscious choice of what we are and are not willing to do to ourselves or to other people. It needs to be about that awareness based on the information that we can get out to each other.
Can asymptomatic individuals transmit the virus?
Did you say
Patrick,
asymptomatic?
can asymptomatic individuals transmit the virus? Is everyone else having as hard of a time hearing me?
Hey, maybe it's just me. Sorry about that.
Okay.
So yeah, as far as we know right now, we're not sure. I think that from what I understand, that's being investigated, whether it can be transmitted during asymptomatic phases of the illness. But we know for sure that during the symptomatic phase, it can.
Yeah, just to add that to that, as far as we know right now, there is not spread before symptoms develop. But like Dr. Gibbons was just saying, this is something that's being really looked at quite closely to ensure that we're correct.
And what I love about this and working with scientists on some of this stuff is that I've learned that the scientific community will never say that something is impossible. And so I think it's reasonable to interpret it from that angle. But what they will give you is good statistics. And we have very clear statistics of up to this point, how this virus is transmitted. That's what people need to be aware of. And we have very good information about what the initial symptoms are for the majority of people. And that's very good information. So I think that if you're aware of what's being shared, anything can be considered possible until it's proven impossible, is what I've learned about science. So
but can we briefly, because I did see this and I thought it when we were talking about the modes of transmission and the likelihood during market days, it needs to be addressed that we did talk about, although we talked about intimate contact, we do need to bear in mind what the circuit parties and what a lot of activity is. Some of those parties, an individual may be there for 3 or 4 hours dancing and having a great time. If there is someone there with a lesion, we need to clarify how individuals can protect themselves and what they need to look out for, because if someone is there, and I totally understand what you're saying in the chat, if they're shirtless, we're drinking, there's 3 or 4 or 500 of us in a place that can only hold 200. We need to talk about how individuals need to protect themselves, and that is a reality for a mode of transmission if someone is there and they're symptomatic.
Can someone speak to that?
Yeah, absolutely. So it's I think that this is being carefully thought about as a mode of transmission. It should be acknowledged that monkeypox classically was not thought of as a virus that was transmitted through sexual contact. You know what I mean? Certainly, it's likely always been a way that it's been spread, but what we do know is that monkeypox is transmitted through skin-to-skin contact, respiratory secretions, often intimate objects like blankets, clothing. When you touch it, when you're gathering it from somebody that's really sick, and also can be spread from mother to fetus. So it's important to keep that in mind when you think about modes of transmission. And during this outbreak, what we're seeing is, it being transmitted predominantly sexually. But we got to remember how the virus behaves, and skin-to-skin contact from one person that is infected with lesions to somebody else that's not infected is a mode of transmission. So if you look at the CDC's website, they have updated it. They are stating that if you're in an environment where you're dancing and there is skin-to-skin contact with clothing that's, shirts that are off, and kind of minimal amounts of clothing covering the body, that there is some risk associated with that. I think it is important to acknowledge that going into the weekend so people know how to best protect themselves. So if they want to take their shirt off, maybe they're doing it, with their friends in the corner and trying to make sure that, you're not coming into contact with other people. It might be the time that you do show up to the club, but you're wearing, you're keeping your shirt on, and maybe you're even thinking about long sleeves this time around. If what you do is love, or if what you love is to dance. So I think everybody just has to be conscious. I think it's very possible to come out and gather and spend time with each other. We know how important that is. I think it's, very important to state that it is possible to come to a street festival and stay safe from monkeypox. But there's different degrees of risk depending on how you enjoy, your summer. And one of those things is if you're making direct skin-to-skin contact, with people in social settings, amongst, populations that we know at are higher risk, then, transmission is possible that way. It's, likely much lower risk than, having intimate sexual relations with somebody else. But there is some risk there. So I think when we all think about, when we're heading out for the evening or gathering with friends, how do I make this safe as possible for me? That's, I think, information that we can all take away and kind of keep in mind as we make our way through this summer.
Thank you. We're a plastic
Thank you
bag.
very much. Yeah. I mean, I think, what I've taken away from that is that, there is ways that you can be very much making your own decision about what level of risk it is that you want to experience, and also to be attempting to mitigate it as best you can, both in terms of as somebody who could potentially be infected and really trying to be a member of society and protecting others, but also being aware of those around you and having conversations with your friends.
Can I just
Go
say
ahead,
one
Jen.
thing? And just for yourself, for your friends, really, if you are or if you are feeling sick, or if you see a sore, or if you're at all concerned about MPV, please stay home and sit it out, avoid the large gatherings, because that really is how this is spread.
And go see it and try to go to a provider. Like, just in case, err on the side of caution. Like, there's some stuff going around. Like, if you're feeling like flu-like symptoms, fever, malaise, all those things, like, all right, normally under normal circumstances, I would just ride this out. Don't. Call a doctor. See if you can get seen.
You do have to have an actual active pox of some sort to be able to get diagnosed. So there's no actual blood test for this. So you do have to have something to culture, right?
That's correct.
You can do,
Yeah.
We have been doing oral swabs as well, you know what I mean, for folks that might have had dried up pox or what we think to be monkeypox, but they haven't started showing it yet. So it is possible to capture. It's more difficult though.
And there's rumors about having a previous smallpox immunization having an impact. My understanding is that's not accurate. You're not protected from it.
Yeah, we don't know how much. We know that the immunity from a smallpox vaccination wanes over time. And so we don't know how much protection it still offers. We do know from some of the data that people who have been previously vaccinated for smallpox, especially long periods of time ago, like as a child, have developed monkeypox. And if you have been vaccinated for smallpox and it's been more than 3 years, then as long as you meet the other criteria, then you are still eligible for the MPV vaccine.
There's a question about the cost of the vaccination.
There's no cost for the vaccination.
What is the best way to care for pox lesions to prevent the spread and also increase speed of healing?
So calamine lotion can really help with itching, doing some soaks in the bath as well, and putting some, oatmeal soaks have been really helpful from some folks. It's very soothing, and it helps kind of the pox lesions work through their cycle, hopefully a little bit faster. And then once it does go through the scabbing phase and it's, the scab is, trying to fall off or it does fall off and that you have some kind of raw healing skin underneath, a moist wound typically heals faster than a dry wound. Believe it or not, it's a little counterintuitive. And when I say moist, I'm not saying keep it wet with water, but actually with Vaseline can be very helpful in speeding along the healing a little bit. And so it's not magic, but it can be helpful in wound care.
Dr. Gibbons, there's another question for you. This is regarding a turnaround on testing. Which locations are more equipped to deal with the influx of potential exposure, assuming that somebody has some kind of symptom that can be actually cultured?
You're asking the turnaround time, is that correct?
Yeah, and which facilities are best equipped to deal with this?
Oh, yeah. And, what we're seeing right now, through Quest Diagnostics is about 48 hours. It waxes and wanes, throughout the week, but 48 hours is what we're seeing for most cases. I really want to emphasize, though, that when you come in and you get evaluated by a provider, the symptoms, we often will tell people clinically, this is monkeypox. Yeah, I'm pretty sure that this is monkeypox. So you're walking away knowing that. And I've even had instances where like, hey, if this were to come back negative because, maybe some of the lesions dried out or something, I'm usually telling people like, we're still going to presume that this is monkeypox. You know what I mean? Because the symptoms in a lot of cases, the exam findings in a lot of cases are, very, very, very consistent with monkeypox, and we're confident giving out what we call a clinical diagnosis along with testing. So most people are going home having a good idea if they have monkeypox or not.
So we're at 6:30. Oh, sorry. Go ahead.
I was just going to say, at Howard Brown, we're really trying to make sure that all of the sites within our network have capacity, and we've been really intentional about making room on schedules. So no matter where you live in the city, that Howard Brown location near you should have access. If it's end of day or something like that, it might be a little bit more difficult, but we're trying our best to open up access at all of our sites for screening.
We're at 6:30, but I just want to ask the panelists, if you wouldn't mind, we still have a lot of questions that have not been answered. Can we go a little bit over? Are you wanting to give your time for that?
Yeah, I think that's a good idea. I wanted to underscore that there's no cost for the vaccine. The vaccine's being provided through the federal government, and partners are administering it for free. There was a confirmation to some appointments that talked about a copay, but that was an error. We sent a clarification. So nobody should be being charged for administration of the monkeypox vaccine.
And that's across all providers, not just Howard Brown.
Correct.
There's a question about the location of the initial source lesion and whether that has anything to do with how transmission occurred. Patrick, I don't know if you could hear that, but oh, you did? Got it.
Yeah, I think it definitely could. We are seeing, lesions that are being focused around areas, where the patients are, voicing, hey, this is, an area that was, involved in the sexual activity I was having. So we are seeing that, but we are seeing in other cases that, the first lesion, is popping up in an area that was not involved in sexual activity. So it's kind of a mixed picture, but a lot of people are having it, in areas where we believe the transmission likely occurred.
There's questions about the impact of the first dose, a number of them. Again, we've addressed this already, but also if you go to Science Magazine, there's an article there that talks about the strong protection that is offered by the first dosage. But this is a new strain of the virus. I don't think anyone knows everything 100%. And with that in mind, you really do have to think about the protection, protecting yourself as best you can. But also getting a second dose before we can actually get the full community vaccinated is going to really make it more difficult to continue to control this and keep it from going to a larger number of people, which is really the goal. Adequate. So let's see, no one responds. I think we've addressed about attempting to get responses out. There are different organizations that you can reach out to. The vaccine is being given across multiple communities. It's not just to people of color. That's incorrect.
Well, just to make sure, so we're working with clinical providers, non-clinical providers, community members across the city to try and get information and vaccine opportunities as available as possible. Again, specifically for individuals who are at risk based on the eligibility criteria. So at CDPH, for example, all three of our STI clinics have vaccination opportunities, Lakeview, Austin, and Roseland. We're working with community partners all over the city to set up opportunities, one-offs as well as ongoing. So it is something that we're trying to make as available as possible within the confines of the eligibility that we have to have in place based on the limited supply of vaccine that we have.
There was a question about getting access. David had responded, but unfortunately, I don't think it went out publicly. We're trying to, and this is regarding responses to messages. We're trying to catch up, responding to 5,000 plus voicemails requesting appointments this weekend. We recommend people call 9 to 5:30 at 872-269-3600. Now I'll copy and paste this complete message into the chat. Please wait to speak with the contact tracer versus leaving a message. And everybody apologizes for the challenge. It's just that with the sudden demand for answers and people wanting to have an opportunity to speak to someone, the medical providers are having a challenge keeping up with that. Let's see. There has been information stating as recommended, we call ahead to the provider to let them know you might have NPV. Is that correct information? Do you need to notify your provider ahead of time that you might have NPV?
It's always a nice thing to say, like if you're coming in for a visit and to be screened, like, hey, I suspect that I have NPV. Giving us the reason you're coming in helps us prepare and make sure that we bring you back as soon as possible, and that your team members who are rooming you are aware. Although we're taking universal precautions with everyone and making sure that we're asking that question as we're rooming people. You know, any rashes? Are you feeling unwell today? Are you just here for routine follow-up?
There's getting reflections on the situation with COVID in terms of how the virus mutated and creating fear for people that, is this going to mutate? Are we going to see the same kind of situation going on with this virus?
I can take that one. So COVID is a completely different type of virus than MPV is. Even just kind of at its like core level, COVID is an RNA virus and MPV is a double-stranded DNA virus. And even at that level, that means that it does not mutate as fast as COVID did or does. That being said, I mean, there have been some changes to the virus that have occurred and I think have led to what's going on now, but we don't expect to see kind of, you know, with COVID, we have Omicron and Delta and all the strains, and we don't expect to see a mutation that is that quick with MPV.
Does this virus, once you get infected, provide some level of immunity? Is it similar to chickenpox? Do people have risk of getting some type of bounce back infection? What do you know at this point?
We believe that people have lifelong immunity from it. It's a little bit hard to know for sure because a lot of this information is based on smallpox rather than on MPV itself. And like I was just saying, there have been kind of changes to the virus, but right now we do believe that natural infection provides immunity kind of different from COVID. And therefore we don't recommend getting vaccinated if you've already been infected.
With market days this weekend, is there going to be any kind of testing and vaccine booths set up? Well, I just want to hit the first part right off the bat. If you feel that you need to be tested, going to a street fair is not the right place to go. Please stay home, because that means that you see something that you think they can culture to get a test result from. You should be keeping that area covered if you're around other people, but more importantly, you should be acting responsibly. But maybe you can address what it is that Howard Brown has planned, and if you know of any other partners, what they plan to be doing at market days.
Wonderful. So we plan to both vaccinate at market days at different points along the strip. And we are also out of the Halsted Street location going to be offering a clinical care team there that can answer questions. And if somebody does find themselves at the event and developing symptoms or just so happen to recognize that, or maybe another screener at another location recognizes that, you can actually get testing at our clinic site at market days. But again, we're reserving, hoping that is for people that kind of find themselves in that moment. Maybe they're being intimate at Steamworks or getting undressed, at Steamworks to be intimate with others, and they all of a sudden note, hey, there's something different here, or they take their shirt off at the dance club and their friend says, hey, what's that? We hope that you can come down to the clinic, and we'll take a look, and we'll even test if there is a suspicion for monkeypox.
Thank you. Let's see. Are people with HIV more likely to have adverse consequences if they get HPV, and if so, is HIV status being considered as a potential factor in who gets the vaccine while the supply is limited?
So from what we've seen, and Jen, I saw you pop on there. I'll leave the vaccine question for you, but I think from what we've seen, patients who are living with HIV that's well controlled and have a robust CD4 count, they are not being, affected by monkeypox, any more than the general population that is living without HIV. We are much more concerned when we see somebody that has a low CD4 count or they're off treatment currently. That is much more concerning. Low CD4 count because the immune system is not as prepared. And then if you're not being treated currently, your viral load is high, the immune system is distracted, and there's a lot of inflammation contributing to a more difficult course. So those people are very much people that we want to keep on our radar, and in some cases even thinking about the experimental treatment known as TPOX.
Are there multiple variations of the vaccine? This person has been informed that individuals with skin sensitivity or eczema should be getting one variation over another. Is this misinformation?
No, there are actually two types of vaccine that can be used. However, the type of vaccine, Jynneos, that we have in Chicago is the vaccine that is safer. So there is another type of vaccine that has been approved for smallpox. It's kind of the one that has been traditionally used. It's called ACAM 2000. And if you know anybody who, was a child kind of, back in the 50s or what have you, they likely were vaccinated with ACAM 2000. It's a different type of shot. It creates a lesion, which then unfortunately can potentially, not a lesion with MPV, but with vaccinia virus, which is a related virus, which the vaccine is made from. But unfortunately, that lesion can be contagious to others and has to be kind of carefully covered until it's healed. And so for that reason, we have largely that, and it has more side effects and cannot be used in patients that have immune compromise, people with certain skin conditions. So we don't have that vaccine here in Chicago.
I've seen a couple of articles about a vaccine cliff, meaning that the US won't be getting more shipments of the vaccine until October at the earliest. Can anyone comment or offer information about whether that's accurate or not? And I'm going to throw on there that I was listening to NPR and understand that there are 300,000 vaccines on the way from the manufacturer at this time to the US. So what's the truth?
So Chicago was just allotted, I think either late last week or earlier this week, just over 30,000 doses of vaccine. This week, we were just eligible to get a small portion of that, just over 10,000 doses, which we're hoping will be arriving late this week, early next week. I don't think we have a time frame yet. There will be additional doses as part of that kind of 30,000 or so dose allocation that will be arriving later over kind of the next weeks to month. And then we expect there to be additional shipments of vaccine in the fall.
So people are wanting to know if you've done anything to advocate for additional vaccines, what can be done to advocate, what effort is being made to attempt to get more shots in arms at this point.
Yes, we've been working with kind of the federal government, CDC, White House, with political representatives to advocate for more vaccine. I think we all want more vaccine. So we'll continue to advocate for that as well. I don't know if anyone has anything to add there.
I was going to ask if you would expound on the state of Illinois or Chicago being declared a state of emergency for this. Does that mean that we'll get more automatically, or does that mean we need to advocate for more because of that status?
Unfortunately, declaring a state of emergency does not affect allocation of vaccines. What the declaration of an emergency means really allows the state to bring in additional state agencies to more easily move vaccine doses around the state. I think while we would love for that to ultimately result in more vaccine doses, unfortunately, it does not do that.
There was a question about people getting access who are from the suburbs or not living in the city of Chicago. Anyone in terms of vaccines?
I think, and the folks from Howard Brown, I mean, you're actually doing the vaccinating, so you might be able to answer this better than I can, but I think what we've said is, that we wouldn't turn people away from like the suburbs, for example, if they're eligible for the vaccine, especially if they kind of live, work, party, et cetera, within Chicago and could be, kind of contributing to what's happening with MPV.
Yeah, of course, I wanted to wait for you to answer that question first, just because, the rules are created by the folks that are handing out the vaccines or giving us our supply. But we have been, supporting that mindset. And I really believe the people that are making it to us from the suburbs are people that are working in the neighborhood, are people that are, spending their time, or I shouldn't say in the neighborhood, in the city, and are spending their time with, communities that are at the highest risk at this point. And, I've done a couple of vaccination events myself and have encountered people from the suburbs, and we've talked about risk, and it's there. So I feel like, even though there's, people coming in from outside of Chicago, all the vaccines that we're getting in arms are well worth it. And yeah, we've been practicing that way.
Thank you. There's a lot of questions about the risks. People want to have a more clear definition. How big of a risk is temporary contact, like brushing shoulders? I'm wondering how big of a risk it is being in a crowd at the moment. What is the risk of bumping up against someone with MPV at market days and being infected? So in other words, casual contact that people might have at the festival, if they do brush against somebody who is infected, what should they be thinking?
Yeah, so when you're at a festival, it's really hard to walk through, a festival area without maybe bumping into somebody. But what we do know is that, it's direct contacts with, a lesion on somebody's body, particularly a lesion that might be open. It's really great protection, especially if that person's actually being clothed. And also if you're clothed, you have your shirt on, maybe you're wearing a longer sleeve that day, just for a little bit extra protection. But walking through a crowd and bumping into people while fully clothed and they're also clothed is, a pretty low risk activity. It changes if you are, in front of a stage and you're taking your shirt off and you're squeezing in between people who also have their shirt off and it's hot and everybody's sweating. That's a different scenario. But it's a little bit of risk associated with that, but it's higher than if you're closed and kind of being more cautious about touch.
Patrick, were you about to say something?
Yeah, I would just reiterate some of the stuff that we mentioned earlier on, which is like it's the casual element of it. That if casual contact, momentary contact, not a concern. Contact through clothing on both sides, not particularly a concern. There's some risk, sure, but like again, what we're seeing is like ongoing, prolonged, like skin to skin contact. That's what we're seeing. Like and so it is understandable that folks that were worried about this more casual spread, that's not what we're seeing. And as has been mentioned a couple of times, like, is it possible? Sure, as Mark referenced earlier, like scientists and public health folks will never say anything's impossible. It is entirely possible that like hanging out with Pomeranians creates a protective layer in your immune system against, like, it's possible. We've never actually seen it. So like we have to speak in terms of like what are we seeing? What is the truth based on the evidence? And the truth based on the evidence that we're seeing transmission within the course of sexual or intimate contact. Is it possible that the circumstances of being at an event or a venue based on your clothing, based on proximity, based on activities, based on duration presents an opportunity? Yeah, thus far, we've been saying sex, though.
And I think another thing to think about is that as they've been doing these contact tracings, the bars have been open, the beaches have been open, the gays community, the LGBTQ community has been hugging, kissing, and behaving in the same manner that it has historically. And there's been one particular type of behavior that has been strongly linked to the transmission. So, you know, being aware of what is the riskiest behavior is a really important thing to be aware of. And then thinking about what you can do to mediate risks along the way. You have to make decisions on what it is that's good for you. But to date, you know, the scientists will tell you there's a chance of everything. And my hope is that we can stop having more people infected so that the chance is even less of it becoming a factor in our society. Because if we are able to stop people from spreading the virus, then we will be able to get enough vaccines in arm, and hopefully that will be coming sooner than later.
I feel I need to say something real quick, and then honestly I have to get going pretty soon to go hang out with my kids before they go to bed. But I want to just note, and I alluded to this earlier, like I want people to be going out and partying. I want people to be having sex. I want people to be dancing. I want people to be like doing all the things. The way to do that is to be aware of the symptoms and the spread, and being aware of yourself and taking the reasonable precautions, and being aware of your friends and lovers and talking with them about what's going on, what you're seeing, making sure folks have the information. Like go have sex safely, you know, like, and love it, do it, bunches. If everybody's cool, if everybody's like, we don't have any symptoms, I've no known exposures, like this is not a like cover yourself in a condom and go to market days like a full body condom kind of thing. Like it's be aware, be cautious, be concerned, pay attention to yourself, pay attention to your friends and lovers and the people that you're with, and then go have some informed, safe, wonderful experience.
It's market days, Patrick. Someone will be walking around in latex. What are you talking about? Someone's going to be in latex at market days, yes.
There will be the full body condom as well.
It'll be kink. It'll be kink.
Can you speak to the MPX vaccine being used as post-exposure prophylaxis? I don't know what specifically to speak to it, but is there something that you want to say about it in terms of effectiveness or use or whatnot?
What's the question again? Sorry.
So the use of the vaccine as a post-exposure prophylaxis, what your experience has been in terms of effectiveness or how this is being played out.
So, you know, the idea is, and the belief is, if we get it in people's arms, you know, within 4 days of the exposure, that it has a pretty darn good chance of preventing a monkeypox infection in that person from them having a clinical case of monkeypox. If it's after 4 days, it's less likely to do that. somewhere between 4 and 14 days, it might decrease the severity of the infection that you have. So as far as data collection, I mean, that's a bit tough. I don't know if anybody is, checking in, I mean, any organizations are checking in, with these patients afterwards, or not, to see and collect that data. But, we're trying our best to get it to people that we know that have been exposed to our contact tracing, and, hope for the best. So I don't know if Jana or anybody else on the call can speak to as far as if there's any data collection on how people are doing after vaccination for PEP.
So we are looking at this, obviously, collecting some of that data. I think probably too soon to be able to share anything. I think mainly, I think you have said this before on this webinar, but that we expect that if given within 4 days, it can potentially prevent disease, 4 days of exposure, and given within 5 to 14 days, then it can, although it may not prevent disease, it can at least mitigate symptoms.
So the two questions that have not been asked or addressed, one is regarding massage, the safety of getting a massage, that and how people should think about that, and then also TPOX paperwork differences, and or the challenges, the difficulty, and what is that being improved, or where are we at on that?
So again, it's transmitted through skin-to-skin contact. Massage is prolonged skin-to-skin contact. However, if the person that you're receiving a massage from is not exhibiting any symptoms that are viral or prodromal or flu-like, and they're also not having any lesions that are known on their bodies, then it should be a safe activity. And if it's something that's concerning and you want to receive a massage, having a conversation with the person that's going to give you that massage would be warranted, just like you might have a conversation with a sex partner about any symptoms that they might be having before engaging.
Just to add, I just had this conversation with a friend of mine who's a massage therapist about it's a thing to be aware of. Does it mean you should shut down your business? Not at this point, but it's a thing you should be talking to potential clients about, and just checking in, making a decision based on what you're seeing, what you're hearing.
So I wanted to throw out there my thanks to the panelists. We have at this point run a full 30 minutes over the plan for this. One of the questions people have is that is there going to be where can they get access to this video or transcript? Does anyone have an answer to that? Or Lisa, are you available to answer that?
Yes, just echoing your words of thanks to all of our panelists for sharing your time and information with our attendees. We will be posting this webinar on our YouTube channel, which is youtube.com/ChicagoBACP. I will post that in the chat box, so you could reference it there as well. And also just going to post the MPV city webpage of Chicago.gov/MPV.
So if you want to put that into the chat so that people can copy and save that, that would be much appreciated. Again, I want to thank Howard Brown and Patrick and David for participating today, the Department of Public Health, also Patrick, Jana, and Antonia, and also from the city's business affairs. The organization is great. Your boss is one of my favorite people, so I appreciate his help in helping to coordinate setting this up for us to be able to have this event today. And I appreciate everybody for joining us. I'm going to sit here for a minute while we wait to make sure that information is going up and that you have a chance to copy it. There was somebody that posted a message in here about vaccine registration is currently available from UIC. I did post the link to that. So please feel free to copy that as well. David has posted links to several short videos that Howard Brown has produced. I'll copy and repaste that at the bottom just so that if you want it, you have it. Otherwise, let's let Patrick go and see his children, and let's let everybody continue to enjoy their lives. Please stay healthy. Let's have a great Market Days weekend, and please let's protect each other by being aware of our symptoms and also being aware of what conduct is going to be more risky and what conduct is less risky. Hope you have a great time. Take care.
Thank you, Mark, for taking this initiative as well. Thank you.
It's a pleasure. I do have to call out, people have said that Howard Brown or that the Department of Health is not doing anything. To be quite honest, from the beginning, Howard Brown and the Department of Health has been incredibly well engaged with Northalsted and our business community to try to figure out how to most effectively inform people. We have videos that are now playing in bars that we produce directly targeting the community going out to the bars, where it's discussing the symptoms, it's discussing transmission, and we're trying to all work together to make a difference. And I think it's one thing great about the LGBTQ community. We really do come together to try to protect each other. And that history is continuing now. And hopefully we'll get through this as we have other health challenges.
Thanks, everyone.
That's enough.
Thank you, Mark.
Thank you so much.
That was awesome.